Okay, so good morning again, everybody. This is Dan Leonard, President of the National Pharmaceutical Council, and we're very pleased to be hosting today's webinar on comparative effectiveness research. And we have a lot of information in a short period of time, so we're going to get right into the discussion here. Before we get going, a quick housekeeping item for everybody. We will be recording this webinar, and it will be posted to our website, the NPC website, npcnow.org, and so you or your colleagues can go back at any time and listen to this webinar and view the slide materials. So feel free to share this with colleagues who maybe were not able to get on the call today. We do realize it's a pretty busy day in healthcare, so that's understandable. To ensure the quality of the recording, as we are recording this, the participants' lines have been muted. Therefore, if you'd like to ask any questions, there is a way to do that. Do that on your screen through the Q&A tab. You'll see the Q&A tab at the top of your screen. Type in your question, click Ask, and at the end of Claudia's presentation, we will go to the question and answer portion. In 2009, as you're all well aware, the American Reinvestment and Recovery Act set aside $1.1 billion for comparative effectiveness research. And a little over a year later, a year after that, the Affordable Care Act established the Patient-Centered Outcomes Research Institute to oversee comparative effectiveness research. So as we sit here today, or I sit here on one end of Pennsylvania Avenue, on the other end of Pennsylvania Avenue, 9 men and women are deciding the fate of the Affordable Care Act, or at least elements of that law. But the comparative effectiveness research components in that law are well underway, and the funding that came out in the stimulus bill, or the Recovery Act, are being expended, and it's well underway, as we said earlier, and it's in full swing. So we have an environment where CER is the current reality, despite what's going on in the Supreme Court today. So all of this new research is and will be coming online in the very near future. So what does it mean, and is it having any impact? Do we expect there to be significant impact from the funding that has gone into CER? And the great promise of CER, of course, is that it will help patients. It will help patients. It will help providers and payers make informed healthcare decisions, ultimately improving the general health care of the population. So is CER really doing that? Is it heading in the right direction? And what do healthcare stakeholders think about it? These are some of the questions that we asked in our survey. This is the second survey in a so far a two-year benchmark. And with the help of social and scientific systems, we created a State of the Science survey to ask many of these questions and to set the benchmark for CER, where it is in this country. We wanted to hear from key stakeholders who are impacted by CER. Those stakeholders included folks from government, the research community, academics, insurers, employers, human resource consultants, healthcare coalitions, and other health-related trade groups. So a very detailed group of stakeholders, and Claudia will go into a little more detail on that in her presentation. Our 2011 survey, this is the one that will be that we did in 2011, set the baseline. It was the first time we were in the field with many of these questions. PCORI at that moment had just been established. It just had its first board meeting. There was a lot of buzz and excitement around what they were all about and what they would be doing. The survey participants were very optimistic at that point that CER efforts were headed in the right direction. They recognized that CER efforts are not going to be a quick fix, that there would be a long lead time until we saw results coming from the CER that was established and kicked off at that time. We're now 2 years into this, into year 2 of our survey, and we're starting to see some of the trends develop. There's still quite a bit of optimism around CER, but as you'll hear in a few moments, the buzz is a little bit more muted since PCORI was actually, is now getting down to business. They're hiring up people, and they're set their national priorities, and they're about to fund a very significant tranche of early research. It reminds me of some comments that FDA's Dr. Janet Woodcock made at one of our conferences a little over a year ago when talking about the time lag in the acceptance of randomized controlled trials. And this was many, many years ago, but she said at that point that it took really 20 years for the RCTs to become acceptable, appropriate research methodology. There was a lot of discussion, gnashing of teeth in the early phases of that, but that now it has achieved a level of acceptance, but it took time. And she was equating that to where she thinks CER is. I don't know that the public's patience will last that long. She used that 20-year time frame. I don't know that the patience of the folks is really going to extend out for 20 years, but I do believe that this survey is likely to be one of the best vehicles to measure that level of patience or impatience with where CER is headed. So we intend to do this every year, and as I said at the top, this will serve as a benchmark for where we think CER is going forward. So today, Claudia Schur, who is Director of Social and Scientific Systems, will walk through the findings of our 2012 survey and point out how the landscape has changed over the last 2 years. So with that, I'm now going to turn it over to Claudia. Claudia?
Thank you, Dan. I'm very happy to be here and to be able to talk about the results of these 2 surveys. As Dan mentioned, both surveys targeted key stakeholders impacted by CER. Our goal was to hear from healthcare decision makers, and as you can imagine, those are very busy people. We used a combination of web and paper surveys, and we used telephone interviewers to encourage participation. If you're following along on the slides, you can see the distribution of the respondents across the different stakeholder groups. Dan mentioned the major categories we were going after. We had almost 30% researchers or thought leaders. Just over 1/4 were representatives of business coalitions. Almost 20% were from insurers or health plans, and then there were somewhat smaller numbers from employers, government, and associations. We had 117 completed surveys out of 370 individuals and organizations that we initially contacted. We're quite pleased with this response for a survey of elite decision makers. In any survey, those who are most interested in the topic tend to be most likely to participate. Sometimes we worry about that as a source of bias for the survey results, but in this case, those who were most interested were also likely to be the most knowledgeable, and so those were the people that we were actually interested in hearing from. You can see that CER is clearly viewed as important by stakeholders. In the 2012 results, and that's the bar on the right, 95% of respondents said that CER is somewhat or very important. That's up just slightly from 2011. But what's interesting is that there seems to have been a small shift between 2011 and 2012, with a drop in the proportion who said CER was very important and an increase in the proportion who said it was somewhat important. So as Dan was alluding to, there may be a slight retrenchment in optimism about CER. Now, as Dan also mentioned, the first survey, the 2011 survey, was in the field not long after PCORI was launched. So it's not surprising that there has been an increase since that time in familiarity with PCORI. 41% of respondents said that they were very familiar with PCORI in the 2012 survey, and that's up 6 percentage points from the 2011 survey. While it's not a large change, it does suggest some movement towards greater awareness. The next set of slides report on responses to a series of questions about which organizations will play a significant role in selected aspects of CER over the next 5 years. And you'll see that the stakeholders see somewhat different roles for different groups. So in this first slide, in terms of establishing research standards, the Agency for Healthcare Research and Quality was the most frequently mentioned organization. 83% of respondents selected it. PCORI was selected second most frequently by 72% of respondents, and NIH by 60%. You can see that there was a big jump for PCORI between 2011 and 2012, going from 50% to 72%. When asked which groups would play a significant role in establishing research priorities in the next 5 years, the most frequently selected groups were again AHRQ, NIH, and PCORI, with 77%, 71%, and 67% of stakeholders selecting those groups. Respondents were also asked which groups they believed would play a significant role in funding and monitoring research. NIH was named by 85% of stakeholders, AHRQ by 74%. The pharmaceutical industry was mentioned here by 2/3 of respondents, and PCORI was a little bit farther behind at 60%, but again showed a big increase of 16 percentage points between the two surveys. In terms of conducting research, almost 90% of survey respondents indicated that academia would play a significant role in conducting research in the next 5 years. 70% selected the pharmaceutical and medical products industry, and 50% selected NIH. So you can see that stakeholders make a clear distinction between which organizations they expect to set standards and priorities, which ones will be funding research, and which ones they see as being involved in conducting research. When asked what kind of impact CER has had on healthcare decision-making, the stakeholders were not very positive about the short-run period, but were more optimistic when looking over a longer period of time. And this is looking at the impact they see of CER on healthcare decision-making. If you're looking at the slide, you can see that the green and red portions of the bars get smaller over the time horizon, that's from left to right, as the purple and blue portions of the bars are getting larger. So looking at the past year, and that was prior to 2011, 83% said that CER had no effect or had led to only slight improvements. However, looking over the next 3 years, looking forward, 77% of stakeholders see moderate or substantial improvement. And with a time horizon of 5 years, that increases to 91%. Now the remaining series of slides show stakeholders' assessments of 9 different issues affecting the healthcare decision-making environment. In the 2011 survey, respondents provided assessments for the time of the interview and 12 months prior to that. Along with the results from the 2012 survey, we are able to compare ratings from 2 years ago, 1 year ago, and today, and that's what you'll see on each of the slides. The first issue that respondents were asked to assess was the availability of new research methods. The blue bars represent the proportion of stakeholders that voiced the most negative view, and the red bars represent the group with the most positive assessment. So for this first issue, you can see that the negative ratings have fallen over the past 2 years. The percentage of people who felt that methods were extremely limited fell from 35% 2 years ago to 16% today, and those who felt that they were readily available rose from 2% to 14%. So while the negative perception fell off considerably, the percent with a positive view is still relatively low, although it did increase. And that's the kind of pattern one might expect to see when asking about these kinds of issues, one would expect over time to see the negative perception falling and the positive view rising. And in general, that's what we see, although there's a sort of a mixed result that I'll explain as we go through. In terms of the negative assessment, we found a decline in negative perception between 2 years ago and 1 year ago, but then the percent with a negative assessment either stayed flat or increased between 1 year ago and today. So when you're looking at the slides at the blue bars, you'll see almost a U shape. You can see that pattern here where 38% of respondents felt that there were no widely agreed upon research standards 2 years ago. It fell to 20% 1 year ago, but then rose slightly to 26% today. What we suspect is going on here is that the initial optimism about progress being made in CER is just a bit dampened, with stakeholders expressing a bit more caution or lowered expectations. In terms of the percentage of respondents with a positive assessment of the availability of research standards, there was a sizable increase, but it's still at a fairly modest level. The third issue, whether research priorities adequately address the treatment choices faced by consumers and providers, shows the same general pattern, with the negative view falling between 2 years ago and 1 year ago, but then rising again in 2012. And on the other end of the spectrum, there was an increase in those with a positive perception of research priorities initially, but then it leveled off between 2011 and 2012. This issue, the use of objective and transparent processes for interpreting evidence, received the highest positive rating, with 19% of stakeholders indicating that current processes are fully transparent and objective. And it's the highest positive rating, but it's still, again, fairly modest. Only 1 out of 5 stakeholders hold that view. Issue number 5 asks stakeholders to react to the predictability of adoption and diffusion of medical treatment and technologies. You can see that even in 2012, only 8% of stakeholders report that adoption and diffusion are highly predictable. In terms of the exchange of medical evidence across different parties and whether there were consistent standards, there was a significant portion of the stakeholders with a fairly negative view, and here again, only a small group of stakeholders with a positive perception. And here, in terms of the consideration of quality outcomes and value in treatment assessments, the patterns look quite similar. Again, you can see that U shape with the blue bars, and here the negative assessment comes almost back to where it was initially, as if no progress at all had been made in that front. The integration of healthcare purchasing decisions across different services was also seen as relatively limited. Only 5% of stakeholders thought these decisions were integrated across the full range of services, while 45% thought that services were still viewed one at a time in purchasing decisions. Again, that negative perception did fall somewhat. And finally, this last issue has the highest negative rating, with 58% of respondents saying that there was little or no use of outcomes-based contracting, and only 5% of respondents indicating that it was widespread. And now I'll turn the floor back to Dan for some further comments.
Okay, thank you, Claudia. Just a quick reminder, if you would like to ask a question as we go into the Q&A portion of the program, please click on the Q&A tab, and you can enter right in your question there. But we have one conclusionary slide which sums up some of the points that Claudia just walked through. Some key takeaways, certainly, that we have observed in year 2 of the survey, as we can follow some early trends, I would say. There is a growing recognition of PCORI and its role within CER. People's awareness of PCORI is growing. They understand the key role that they, as an organization, will be playing going forward. Stakeholders are more pragmatic about how CER will be used and who will be funding it. There is a higher level of optimism about the availability of research methods and standards, transparency, and objectivity in an interpretation of CER, but there are lower expectations about the consistency and consistent and transparent methods for exchanging information, and that broader measures of value are not considered. So there is optimism in some areas and lower expectations in other areas. I'd like to remind folks once again, if they'd like to ask a question, to enter it into the Q&A tab, and we will try and make effort to answer those questions. So you go to the Q&A tab. Okay, so a couple of questions are coming in now. There's a little lag, I think, between the questioning and the ability to see them on our screen here, so I apologize for that. The first question, Claudia, is do you have breakouts of the findings by respondent? Yeah, and this is something that we have looked into, so where different stakeholders are in their answers. So payers, for example, government respondents, do we have those breakouts?
We do have some breakouts. The overall, those subgroups are a little bit small to really say anything at all definitive. But in general, we did find that the most optimistic groups about the impact of CER were the researchers and thought leaders. And that was initially, and that carried through to the current year. Between 2011 and 2012, the insurers and health plans, though, they had the biggest change, and so they came from a little bit farther behind the researchers and almost caught up there in terms of thinking positively about the impact of CER. But these subgroup conclusions are very tentative because of the small sample sizes.
We have another question which is very timely considering what's going on today, as I said, on the other side of Washington, but how will the Supreme Court decision on the constitutionality of the Affordable Care Act potentially affect the funding and forward movement of CER and PCORI research? And I'll just say from where I sit, or from NPC's perspective, and what our understanding of what the court is considering is multi-layered. So one thing they're considering is the constitutionality of the individual mandate. And if they purely act on the individual mandate, that does not affect the entire act, and so the rest of the act would remain intact. Now, how practical that law will be going forward without a key component of it is another question, but it does not eliminate the Affordable Care Act. They could, however, rule unconstitutional the whole act, although most people think that is less likely. And if that were the case, then the PCORI, for example, the parts of the law that relate to CER could be impacted. The funding that came out of the stimulus law, the ARA bill, as I noted up front, has already been appropriated, and that would stand. But the components of the Affordable Care Act would be in jeopardy, if you will. But that does seem to be less likely. Claudia, do you have any take on that particular question with regard to the Supreme Court?
No, I think what you said hits the nail on the head exactly.
Certainly, we'll keep our eyes on that. Here's another question. What are the one or two results that surprised you the most, that were not consistent with what you expected, or where maybe we saw the most deviation from the first year? Claudia?
Well, I guess I would say that I was just quite taken with the change in the negative perceptions and that sort of retrenchment, if we're right in thinking about that, there was this initial optimism about CER, and while there still is some optimism and certainly folks are looking to comparative effectiveness research to help us with our healthcare issues, there is that caution out there, and it seems like there's just a wait and see attitude maybe, or some retrenchment in the optimism. So that surprised me, and the consistency of that surprised me.
And another actually series of questions coming from one of our participants. Will the presentation be made available to the participants? Yes. So you see on your screen now the website for, our website, npcnow.org, and the teleconference or the webinar will be available on our website. How was CER defined for the audience? So Claudia, when you did the initial interview, how are you defining comparative effectiveness? And a second portion of that question, what was the percentage or proportion of the participants that came from the health plan community?
Well, let me answer that second part first. And we had 19% of the 19% of the final interviews were completed by insurers and health plans. I'm going to take just a second to find the way that we defined comparative effectiveness research. What we said was, please think about comparative effectiveness research as the comparison of available treatment options in real-world settings, utilizing a range of research methods that include randomized controlled trials, observational studies, and systematic reviews. And then we said evidence-based medicine is the foundation of CER. So that was how it was defined on the survey instrument.
Great, thank you. So going back to the first part of this question, and the question many of you may have with regard to the availability of these materials, the slides, the recording, etc. All of that is available now on our website with regard to the slides and the material, the background on the survey. The recording we'll put up as soon as it's available. We're being recorded right now, so it's live, and then when it's processed, we'll put it back up. But if you want any of this information or you want to forward it to colleagues, it will be available from our website. There is a new question that's just come in. Okay, Claudia, would you describe the changes that you observed in enthusiasm and its decline in terms of confidence intervals or statistical significance? So were you able to measure that, and can you comment on that?
Sure. The testing we did of statistical significance was actually between the means on the ratings rather than the extreme values. And I believe that almost all of them, I think it was 8 out of the 9 issues, there was a statistically significant change between 2011 and 2012. But we did not test the extremes. I would expect that those would test out in the same sort of way, though. So I think we can say that there were changes, marked changes for most of those issues over the years of the survey.
Good. Thank you very much. Well, that was an exceptionally efficient webinar. I'm very pleased. This is the first one we've done, and I suspect there'll be many more coming. But thank you, Claudia, for your presentation and for the great work that you did on this survey. As I said, this will be an annual survey, so it'll be very interesting as we go forward to track these trends in CER going forward. But it's now a little past noon, past our appointed hour, and there are no more questions in the queue. So I'm going to thank you, Claudia, and I'm going to thank everyone who joined us today to participate in our webinar. So thank you and have a great day.